Greetings to you all. Welcome to another version of Licensure Hub. As earlier on indicated in my objectives is to make passing Ghanaian licensure easy for every final year student. Today we are also going to look at more of the medicine questions and explain or justify why our answer is this. To begin with the question on the screen which reads, an antidiuretic substance important for maintaining fluid balance is released by A. Adrenal cortex, B. Posterior pituitary gland, and C. Anterior pituitary gland. Looking at this question, viewers, you should clearly, or one must quickly remember his endocrine system in order to select the correct answer. The antidiuretic substance, also called the antidiuretic hormone or ADH, its other name is also called vasopressin. And so when the question is being twisted again, where you see vasopressin in the question, it still means the same as the antidiuretic hormone. Now, this substance critically is produced by the hypothalamus. And so the gland that produces the ADH is the hypothalamus. When you take the hypothalamus, it produces two main substances. That is the oxytocin and the antidiuretic hormone, also known as the vasopressin. These are the hormones produced by the hypothalamus. And so if you see your MCQs asking that which gland produces oxytocin and antidiuretic hormone or vasopressin, your answer should be hypothalamus. However, when the hypothalamus produces these hormones, it needs a support to store it. And so the supporting system that it runs to store these hormones is the pituitary gland. When you take the pituitary gland, it has two main divisions. We have the posterior lobe and the anterior lobe of the pituitary gland. The posterior lobe is noted purposely for storage of hormones produced by the hypothalamus, whereas the anterior lobe contains releasing and inhibiting hormones, or people can say stimulating and inhibiting hormones. So the posterior lobe, its primary function is to store hormones, whilst the anterior lobe contains stimulating and inhibiting hormones. So when the hypothalamus produces the oxytocin and the ADH, the correct site of the pituitary gland that it goes to store it is the posterior lobe of the pituitary gland. And so per this question, the correct answer should be the posterior pituitary gland, making option B our correct answer. This question reads on your screen, a 69-year-old female presents with painful vesicular lesions on the right side of her back in the T10 dermatome. Which of the following is indicated for herpes zoster, that is shingles? A. Miconazole, B. Acyclovir, C. Prednisone, into brackets oral. Before one can make a correct answer from this question, one should know that, or one needs to apply his pharmacological knowledge here. Herpes zoster infection. What type of infection is it? Is it a bacterial infection? Is it a fungal infection? Is it a viral infection? You being able to know the type of infection herpes zoster is alone is enough to select your correct answer. And so we know that herpes zoster infection, that is the shingles, is a viral infection. And so once you are able to tell that herpes zoster is a viral infection, you should be able to narrow yourself to the medications. Option A, miconazole, should know or should tell the student or the candidate that that is a fungal medication, because most antifungal medications which belongs in imidazole class, you can have fluconazole, itraconazole, ketoconazole, so they end with the nasal. So miconazole is an imidazole class under antifungal, making option A a fungal medication. Option B, acyclovir, is a class of medication that falls under antivirals, And so that makes our option appropriate. Acyclovir, the correct answer. Prednisone is a corticosteroid. It's a medication that falls under the class of what? Corticosteroids. That plays no role in what they are looking for. And that makes our answer acyclovir the correct answer. Our next question on the screen. Which of the following will be prescribed by physician if symptoms of warfarin overdose occur? A. Vitamin K, B. Protamine, and C. Heparin. This again is a pharmacological question that seeks to test our knowledge on pharmacology. The question says that a medication has been given or prescribed. When an overdose of that medication occur, what would the nurse anticipate that the physician will prescribe again? The medication mentioned there is warfarin. Now, warfarin overdose, its antidote or reversal agent is vitamin K. That explains why when a newborn is given birth to at birth, because the newborn lacks these clotting factors and that it can risk the newborn to bleeding, they inject the newborn with vitamin K at birth. Vitamin K is one of the vitamins that is produced in the bowel, specifically the large intestine. And because the infant intestine are sterile at birth or are not developed at birth, it lacks that ability to synthesize vitamin K. And that's one of the reasons why it's given at birth. And so looking at the options, vitamin K is the antidote to warfarin overdose. Option B, which is protamine, protamine is the antidote to heparin overdose. And so if the question comes again in a different year, asking you that which of the following is a reversal agent for heparin overdose, that should tell you your appropriate answer should be protamine. Heparin is not the right treatment for warfarin overdose, and so option C is also out of our answer, making vitamin K, which is the option A, our correct answer. The next question also reads, a patient reported to the OPD with the signs of difficulty in swallowing, regurgitation, and pain in the chest. What condition is the patient likely suffering from? A. Achalasia, B. Angina, C. Pneumonia. Out of the answers given, let us look at certain parameters given in the question. There was difficulty in swallowing, which can be clinically or medically called dysphagia. There was regurgitation and there was pain in the chest. Looking at the symptoms spelled out, difficulty in swallowing is one of the classical signs of achalasia, and the pain being defined in the lower chest should tell you that that is the lower part of the esophagus, because achalasia is a condition that is characterized by the failure of the lower esophageal sphincter muscle to relax. And so when the lower esophageal sphincter muscle fails to relax, food that is swallowed cannot move with ease into the stomach, and that is where you have the pain in the chest or difficulty swallowing. And so that makes our answer achalasia the perfect choice, because the symptoms spelled out in the question should tell the candidate that there was difficulty in breathing, there was regurgitation, and there was pain in the lower portion of the chest. All these are distinctive signs of achalasia. I hope you all had a very good time and have really understood the rationales that have been spelled out. Thank you very much for listening, and I'll urge all of you to continue to subscribe and share the Licensure Hub to all nursing students or your friends so that we can have more time to interact and learn more. Thank you very much, and anticipating the next video.